Hello again, and this is the podcast Paranormal Family Therapy, and I am the host, Dr. Darren Wallace. I'm a licensed marriage and family therapist, a licensed clinical social worker, and a certified addictions counselor. And I've been working with families since 1996, and I've been working with families dealing with paranormal phenomena in family therapy since about 2002, so about 20 years. Paranormal Family Therapy is a podcast that talks about paranormal phenomena and how the psychotherapeutic community interacts with the paranormal, with family therapy in particular. So today I'm here with Dave Blair. Welcome, Dave. Dave is a licensed clinical social worker. He's also a certified addictions counselor, and he is an AAMFT approved supervisor, which means he's trained to supervise marriage and family therapists. He's also one of the founders of Denver Family Institute, which is a 2-year postgraduate training program in marriage and family therapy. He's also the founder and owner of Denver Family Therapy Center, which is one of the largest group practices of family therapists in Colorado. Dave is a longtime faculty member of the Graduate School of Social Work at the University of Denver. He's also my mentor since the early 2000s. He's been practicing with families since, I think, around 1975, something like that. So about 47 years of experience. So thank you, Dave, for being with us today and participating in this case staffing of a haunted house case that I had in 2013. So this is one of the more interesting cases that I've had because this one actually involved objects that would move on their own. Mm-hmm. And so anyway, what we'll do is we'll talk about the case just like as we would if we were about 3 or 4 weeks into the case, because this already occurred 9 years ago, so I actually know how it turns out. But I think it's interesting to be able to staff and for people to watch, what does it look like to, from a family systems perspective, to staff cases that involve, a haunted house. And so anyway, okay, so Dave, this is the family that we're looking at. And I did just a basic genogram from some of the things that I remember from quite a few years ago. So we have Phil, about 42 years old. Samantha is his wife, 38. Carly is their daughter at 13. So as you can see here, they've been married for about 16 years. There's a family history on Phil's side of the family with alcohol and depression. And so similar history on Samantha's part as well. A couple of family members with alcohol problems, and she herself with depression and anxiety. Carly with some depression. Now, most of the paranormal activity is happening around Carly, although all three family members have seen this, and that another part of the problem is Phil's drinking. He's got an alcohol problem and is not interested in giving it up all the way, but he is interested in toning it down. So they're a middle-class family, agnostic and spiritual, not religious. They don't believe in a particular religion. There's the three of them that live in the house. Ethnic background: English, French on dad's side, Native American and French Canadian, Welsh on mom's side of the family, both 2+ generations in the U.S. Nobody's taking any medications. So Phil, the dad, he sees the problem as the shadow man is somewhat of a problem to him. He's somewhat fearful of it, but he sees it more of as an annoyance. He does recognize that his drinking is a problem, wants to do something about it, but definitely does not want to be sober completely. He wants to really have a harm reduction sort of model where he drinks less and it's more of a control thing that he's looking to be able to do. Now, all the rest of the family, his wife and daughter, absolutely see the shadow man as a problem, and they also see Phil's drinking as a problem.
Help me understand, how is he that a problem for them? How is the shadow man a problem?
Well, it's scary to them. So Phil is somewhat fearful of it, sees that it just kind of scares him. Samantha, the mom, is petrified by it. And so whenever she sees it, it freaks her out, and she gets panicky and doesn't know what it is and why it's there and what's it doing. And part of it is this atmosphere that now sort of permeates in their house. I mean, it's one of those things where they can be completely normal outside of the house, not have any, particular sad or anger, problems or feelings that might be happening outside of the house. But as soon as they enter the house, then it sort of hits them like a ton of bricks once they enter the house. And so, Samantha really sees the shadow man as sort of the central part of that. And so Carly sees it as a problem, but also there's a part of it that's pretty attractive, I guess, to her, because she is getting all of this attention because the shadow man tends to focus on her. And so she has some ambivalent feelings and thoughts around getting rid of the shadow man. So she doesn't want it around. It does scare her at times, but then also brings her some attention.
I was going to ask, so is there like a little sequence of events that happens when mom sees this, she gets petrified, and then what does she do? Does she then protect Carly, or what's the next? So she's petrified. So what happens?
Well, she frequently wants to leave the house. Samantha does.
Okay.
And so, and get everyone else to leave the house as well. Now, It doesn't bother Phil as much as it does Samantha. It doesn't bother Carly, although it does bother as much as it does Samantha.
All right.
And so there's a different level of fear and anxiety around the shadow man than depending on which family member it is.
When mom sees this, and says, let's get out of here, does it result in some kind of argument, or
they struggle around where are we supposed to go, and who's gonna take us in, and we can't run from our problems, kinds of things.
Does it bring Phil and Carly together?
In some ways, yes, but so they, in that way, it kind of brings them together, but they still have a lot of conflict over Phil's drinking.
Right.
And so, so in one way, it facilitates and sort of serves a function to foster a stronger relationship between the two of them around that. But then the problem of his drinking and the arguing and the problems that come from that are also present in Carly and Phil's relationship.
Okay. Does Samantha ever fully leave the two of them in there?
Well, I think she's left for the moment, but she comes back. It's not leaves for days at a time. She doesn't do that. No. Okay. So what you have here is these different triangles. So here's myself, here's the mom, Samantha, here's Phil, the dad, and then the daughter, Carly, shadow figure. So there is, I'm trying to align myself with all of the family members, and I have an overt conflict with the shadow man with alcohol. There's also that between Samantha and alcohol, Carly and alcohol, but not Phil and alcohol. He does recognize that alcohol is a problem, but he wants to keep it in his life, right? He believes something probably should be done with the shadow man, right, but also it does take away at some level the attention from all of his problems with his drinking. And so in some ways he actually aligns with the shadow man it kind of relieves some of that from him. And so Carly also has that ambivalent relationship with the shadow man, but she is in conflict with alcohol. And so you can see all of these different triangles and how they're balanced, and then some are unbalanced. Myself in particular, unbalanced, where I'm triangulating myself with someone against something else in order to put pressure. So, at least for me, what I've worked hard to do is make sure my relationship with Phil is strong here, so that, this conflict with alcohol that I have will help to influence at some level this relationship here that Phil has. And that is replicated with at least Samantha and Carly when it comes to alcohol. So that it's putting pressure on this relationship here between Phil and alcohol, because all three of us are against alcohol, and he's at least has some ambivalent feelings around it.
Which does create its own problem, because then it's going to be hard. Well, you probably struggle with trying to maintain a relationship, a supportive relationship with Phil. He feels like it's 3 against 1.
Yeah, except it's where Samantha and Phil are not getting along. Carly and Phil are not getting along. I am getting along with Phil.
Right.
Yeah. That's why it's absolutely important with this relationship here between Phil and I, that I maintain that good relationship and the rapport that we have. Mm-hmm. Right. So then otherwise I would just, if I were in conflict with him, then unfortunately I would just replicate the other 2 triangles. Yeah. And it would feel like he's ganged up on, but I maintain that to try to have that good rapport and relationship with him, so that it isn't just him being ganged up on.
Right. And of course, these are fluid. They can change, depending on the context at the time.
Sure. Yeah.
But it's interesting to me because it really, I work with a ton of alcoholic families with alcoholics, I should say. And, there's that kind of famous theory about that addiction is the opposite of connection.
Uh-huh.
And so you can see that Phil is connected to the alcohol. Now, I'm not necessarily saying he's an addict, but it's addict-like behavior. So Phil is connected with alcohol, which means he's disconnected with the others.
Yeah.
That's one way of thinking about the triangle.
Yeah. Mm-hmm.
So that's a fundamental kind of thing. This is a really good way of seeing that, how it ends up isolating him.
Mm-hmm.
His only real positive relationship is with alcohol and possibly the shadow man.
Yeah, because it removes some of the pressure that his problems with alcohol have, right? It gives the family a different focus.
Right.
Other than him. Yeah.
And I saw something in your notes about that. Yeah, it ends up being kind of an ally for him, because he's pretty much disconnected. So in some ways, that's where it takes us to the alcohol and shadow man are kind of metaphors of the same object, but they are different.
So, so what we have here is the structural map, Minutia map. And so the current one is still is kind of on the outs. Samantha and Carly have a enmeshed or diffuse boundary between the 2 of them. And then the goal state is for Phil and Samantha to be on the same level hierarchically, with a clear boundary between them, and then clear boundaries with Carly below the parents hierarchically.
Is that your goal, Darren, or is that the family's stated goal?
That is the goal. They didn't state it like this, but that is their what they want, is to be able to be functional, mom and dad to be functional with each other, and take some of the pressure off of Carly, since Carly's been on. This is some of the attention that's given her a little more power and authority in the family, which is a little too much for her 13-year-old self.
If you were to draw the shadow man in either of those maps, what would it look like?
The shadow man would be there'd be a fused boundary between the shadow man and Samantha,
Okay.
but it would be probably a clear boundary between Carly. Like there's certain parts that she doesn't like of it, and there's other parts that would the boundary would serve that, and then there's openness to it as well.
Right.
All right. So here is their circumplex. Their beginning state be chaotically separated, and their goal state is flexibly connected. So working with however we can to increase structure in their adaptability adaptability to changes, and also helping them as they move towards more connection, to be more connected with one another. So all of my intervention should in some way, shape, or form reflect, an increase in structure and an increase in connection at the same time.
Is there an issue around neutrality, around your belief in paranormal stuff? Do they, and it's kind of like, how you get religious cases and people will say, well, are you a Christian? Mm-hmm. The question is about, I can't really work with you unless you share my belief system about God.
Yeah.
Right. That kind of phenomenon. Does that happen with these cases?
This one,
Darren, you see this as real or not real? This
one is the only case of mine where it was impossible for me not to believe them.
Okay.
And the reason why this is the case, I remember I told you all about this, is that the chair moving in my office.
Okay.
Like
yeah.
That's this case. So this is the only one where it was impossible for me not to believe that something was going on, because I actually saw an object in my office move on its own with this one. Yeah.
Had you been drinking before the session?
No.
Were you using psychedelics? You are from Colorado. Was any of that stuff on board?
None of that was happening.
I know, Darren. I know you wouldn't do that, but it's interesting. Did it freak you out?
Oh yeah, I was totally freaked out. Like they've been telling me about this, objects moving on their own. It's freaking them out, especially Samantha. But it's one thing, hearing about it, and I didn't really have any doubts, because all three of them said that they have seen this thing. It's different if one person is seeing something.
Okay. Oh,
right. If one person's seeing something, then a thing that goes through my head is, okay, is this paranormal? Is this some kind of psychotic disorder? They're hearing things or seeing things that aren't there. Schizophrenia or some other thing. But when multiple people see the same thing, then it does help to clarify some of this. Now, the thing is ghost in the house or not, we're still going to work on the same things.
Oh yeah. Right?
How can they connect with each other? How can they become a unified front? How can they, all get together and work on the same, goal, right. Whether that's to get the ghost out or to work on these other issues that are parallel to the, problem of the spirit or whatever is in the house.
Right. That's what makes family therapy or systems therapy great for this approach, because it's just like any other problem. And we do this for a living. We try to understand that system and how to help it get organized in a way where you can facilitate some change. If you just saw people individually for this, you'd be dragged into the medical model, right? Trying to decide if they were psychotic or not.
Yeah, and what kind of meds to try to get them on. Yeah, right.
So this allows you to have a different view and not pathologize this person who's seeing the ghost.
Yeah. Right. Mm-hmm. So now part of their goal was to do something about the shadow man, right? Part of their goal was to do something about Phil's drinking, right? How can Samantha and Carly be part of the supporting him as he's doing that? So so as they were doing that, they were working at doing more things together, productive things. And outside of the house, right? There was something about, when they would go inside of the house that really put pressure on them to, it really amplified all of their emotions, negative emotions, once they entered the house. And once they left the house to do things to connect with each other, and what they ended up doing, what we worked at was that they would go work out together. That was
I remember
a way that they were, it was cutting down on the drinking time that Phil had. It was, helping him to, manage his emotions in a different way than just drinking. So it did cut down on that and simultaneously helped them connect with one another outside of the house so that they could bring some of that positive momentum into the house each night when they did return after they'd go to the gym.
And that makes great sense. I mean, that's a super logical intervention. If you get Phil connected with his daughter and with his wife, like if they're doing something as a family, then you're back to kind of supporting that hierarchy. Mom and dad are there working together, working out with their kid, bringing them closer. It's impossible to drink while you're doing that.
Yeah.
So it forces that whole connection idea. It increases connection, which is going to, in theory, decrease his connection to alcohol.
Mm-hmm.
That's the theory. So that sounds like a great intervention if you can get them to buy into doing that.
Yeah.
I'm wondering, did the family, any of them, make a connection between Shadow Man and alcohol?
Well, I think they made a connection between how they felt towards each other and the presence of the Shadow Man, right? Is that as their conflict increases, then he appears more often. He appears more frequently and for longer durations of time.
Right.
And so that they did make a connection. Like the more conflict they have, then the more often he shows up. When they're actually connecting with each other outside and they feel good about their relationship outside, and then when they come back in, he doesn't appear as often. Right? That didn't mean it disappeared completely, but some of the power of that diminished. And there's that parallel between their ambivalence around getting rid of the Shadow Man and their ambivalence around getting rid of alcohol. But as they were working towards at least diminishing the power that alcohol had, then sort of the attachment to, keeping the Shadow Man around also diminished.
Right. I mean, it's logical from our perspective, but they had to kind of learn this through a process.
Mm-hmm.
That's kind of how I would think about it. I mean, it's it's classic. If there's going to be more conflict when there's alcohol on board, everybody can see when dad has drank too much.
Yeah.
They know it. They can smell it. They can see it. He's not present, but it's secret. We don't talk about it.
Mm-hmm.
He'll say, no, it's not true. I didn't drink. Everybody fucking knows he drank.
Yeah, he did.
He knows he drank.
Yeah. Uh-huh.
So, but they're in kind of denial about it. This ghost or Shadow Man is kind of, it's super interesting to me to think about it, because that's basically, that's alcohol. That's alcohol. That's a drunk person.
Mm-hmm.
In a way.
In a lot of ways.
He's causing conflict and tension, but we don't. It's a kind of a mystery. It's in denial.
Mm-hmm.
But we all know he's there.
Yeah, we all know he's there. Some piece of him is like desired to continue to be there, and then other parts we want to get rid of. Right. It is a parallel between those two.
Yeah, it's fascinating.
Yeah. And so as we were working on the alcohol piece, and that got better, so did lost some of its power. The conflict diminished, and so the frequency and duration of how the Shadow Man would appear just started to diminish, and even walking into the house, it was a bit lighter because they weren't in as much conflict or as intense conflict with one another as they once were.
Or fear.
Yeah, the fear. Yeah, they were more united, and so they go to each other instead of just freaking out, right?
Right. But I'm curious. You'll tell me as we get into this, but I'm curious about the ability to, your structural intervention doesn't have to uh, make the metaphor explicit. It's not necessary that they would begin to see the shadow man as kind of alcohol. They would just notice that the shadow man was gone as the alcohol was gone.
Mm-hmm.
I just think that's kind of interesting. I like it when we can sometimes make changes with a little bit like hypnosis, just working in that metaphor without making it explicit. Because in this case, if you made it too explicit, then might start to challenge the belief about, is that real or not?
Mm-hmm. Yeah.
So not alcohol. That's really a thing that's scaring the shit out of me. So,
well, there's another parallel which became eventually part of this, and they were open to this, is they were open to not necessarily a spiritual person, at least at the beginning, coming in and getting rid of this thing, but they were okay with paranormal investigators coming in and figuring out, what is this thing and why is it there and things like that, which they did. And so that group of people, the paranormal investigators, were sort of like the parallel to me. Like I was helping them with the alcohol thing, where the paranormal investigators were helping them with the shadow man. Right. And we had these parallel interventions where we're getting rid of the thing that, was problematic.
Right.
Right. And then the paranormal investigators and I worked together somewhat. Right. We talked to each other and I made sure that I was aware of what they were doing and, what they needed from me. And so all of these folks were working together, including me. Doing the same thing.
Is there any this is just a out there kind of question, any thought that the shadow man was like a spirit from his past, like his father? Was his father an alcoholic, or his grandfather an alcoholic, or any of that?
Yeah, it was a what the paranormal folks were calling, they called it a what's called a PK manifestation. So psychokinetic manifestation of what was going on for Carly is actually producing in a weird way. This might sound kind of strange to you, but in a weird way, kind of produced this thing so that it was acting as the problem for the family, right? It wasn't necessarily like according to them, like a spirit of a dead person necessarily. It was like coming from Carly. Carly is a medium.
Oh, that's interesting.
Yeah.
Yeah. So yeah, it was acting as it was a substitution for alcohol.
Yeah. It was like acting out the anger and frustration and the problems of the family and the turmoil, right?
Right.
Which was really powerful. So then, you get rid of that thing, get rid of the alcohol, then all of a sudden, and all of the family members are aligned with each other. And it actually turned out to be a pretty good outcome.
Right. I'm thinking that, I want to give credit to the family therapy. I'm thinking that that your intervention, I mean, it sounds super simple, but we can see all these charts and graphs and stuff like that, so we know it's complex. But in its application, it's simple. Get this father to be more engaged in a healthy, emotionally connected way with his wife and his kid.
Correct.
And
by push out the alcohol.
He's going to have to let go of the alcohol in order to do that. So we put him in an unbalanced triangle. It's kind of like you've got to choose between your relationship with alcohol or your relationship with your family. You're kind of torn between two lovers. What do you want?
Mm-hmm.
They both serve a function for you. So he wants both, which you can try and see if that will work. But it's probably through trial and error. He's going to have to discover if he maintains that relationship with alcohol, he's going to lose his family.
Mm-hmm.
Maybe not physically, but emotionally.
Mm-hmm. Yeah.
So that's so you kind of put him in that bind, but in a caring way. You're not like doing an intervention or hollering.
Yeah.
You're just saying, you say you want this with your kids. We all think it might be better for Carly if you two are working together. And that's something you all identify as a problem. So we're working through that definition of the problem to get them to do this. And it has this outcome of forcing, it's a ripple effect of the system. It's forcing a change of relationship, both with alcohol and the shadow man. Whether it's real or not is irrelevant, in my view.
Yeah, because the process was the same.
Yeah, exactly.
The process was the same to help rid the family of alcohol. It was the same process to rid the family of the shadow man, right? It was the same process.
Right.
That's at least what I've been saying for years now around the work that I do with the paranormal. It's like whether there's an actual ghost or a spirit or whatever is happening or not, the process of getting the family to collaborate with one another, to be a unified front with whatever's going on, and to also help them collaborate with whoever they need to in order to get rid of this thing, is still going to be the same, because they just have to collaborate with each other, right? They have to be a unified front. They have to work through whatever differences that they have and be able to hear each other and connect with one another.
What's interesting to me is how, such a complex and mysterious thing can, our systemic lens allows us to do this kind of minimalist move, and it has this ripple effect throughout. And that's what we do in family therapy, right? That's our central hypothesis. We change part of the system and the rest of the system is going to have to change. It can't stay the same. Now, we don't know where the hell it's going to go, but that's what our job is to kind of guide it through there. But by the simple maneuver of somehow framing it in a way that they bought it, you got this father and mother to pull together and work together and go out and do things with the kid. And the kid was starting to get what she wanted from her father. Wife was getting what she wanted from the husband. The husband was starting to feel like he was part of this family. Wasn't to blame, because those folks oftentimes feel guilty, and so they spend a lot of time hiding and drinking in the closet, and so they're more and more disconnected, but it feels like crap at the same time to them. So that's that ambivalence. So so your intervention, I would say, triggered whatever the following changes were, or allowed that to happen. If that hadn't happened, I don't know that. That freaking shadow man was serving a pretty important function. It was holding it together.
Yeah,
that was the homeostasis. They were stuck around that shadow man. It was paralyzing them. They couldn't go about trying to fix what they could all see was wrong.
Yeah, and it kept them locked into the same patterns over and over again. Right. It was just what got them out of one problem was that second order change. It got them out of actually multiple problems, right? They just changed the process that that they had with one another, right? And change the system, right?
You change one part of the system, the rest of the system is going to change.
It had to. It had no choice. Yeah.
Well, they have a choice. That would have happened had you not joined with them well, because they could fire you.
Yeah,
say, well, he doesn't know shit. We're going to find somebody who knows what to do here.
Yeah,
or whatever. They could have done that, but you used your relationship with them, connected with them, helped and worked within their view of the problem, rather than kind of trying to impose some kind of view on them, whatever it might be.
Yeah, that they didn't buy into. Yeah,
they didn't buy into. So and you spoke their language, and you worked cooperatively with these other folks whatever they're called, the
Paranormal investigators. Yeah.
Yeah, I mean, we worked with them. They were partners. They could have been, if you would have said, well, that's all a bunch of hocus pocus, you would have lost them, and they would have been even more, they would have even been more locked into to the power of this paranormal object. Be my
guess. This thing. Yeah.
I might be giving too much credit to you and the intervention, but I kind of think it was instrumental in
And it did turn out okay, right? By the way, it turned out.
Tell me what happened. What was the outcome?
So they ended up, having they were open to a spiritual person, coming in and helping them deal with this thing. They made it easy for this thing to go away because the three of them were getting along much better. And they did discover, look, Phil discovered he couldn't do this harm reduction model, right? They
almost always do if you hold their feet to the fire.
Yeah, he actually had to give it up. And once he did, which wasn't easy, but once he did, things just got a heck of a lot easier. And he realized it. Everyone realized it. There was some, after the aftermath of some of that, they had to deal with, but it was overall pretty solid and positive. And so, it turned out well. I mean, this was a good example of how it was helpful, the process.
And did the shadow man just disappear?
Yeah, they got rid of it. Yeah, because some of that had to be done also in individual therapy with Carly, right? Is to to work with that. No, I actually, I had her referred her to somebody that worked with her on, managing her emotions and being able to work through some of the depression that she had and a little bit of anxiety. And so that was one of those situations where I'd worked with a family. I could have worked with Carly. Probably would be good for her, since I was doing so much family work, for her to do work separate from me with that, which I think turned out pretty well because I did so much family work with them. Might have been too much.
Yeah. What would the family have said is what was there, if you interviewed them today and said, why, or if I did, I'd say, how did you finally get rid of that shadow man?
Well, what they did is there was a process that they went through with the spiritual person that came in that pushed this thing out, but they
they created a little ritual or something.
Yes. And but they had to keep it out. Like that was their work. They had to keep it from coming back or remanifesting.
Okay.
Yeah. So they had to do that. That was their part in that.
So that's really interesting. So they had to continue to do this thing that you had them doing, working together as a family, supporting this connected family.
Uh-huh.
They had to do that, or he would come back. So, which is the parallel with the alcohol. You can't have both.
Mm-hmm.
So they had to kind of choose between this ghost or this object or their family and maybe their kids' mental health.
Mm-hmm. Yeah, and they picked the right one, obviously, and were able to work through it. Yeah, so it turned out well.
Sounds like a good family, and they had some strengths.
They did.
They weren't really dealing with a lot of other issues. It sounds like, but it's good.
Yeah, it turned out well. Thank you, Dave, for being with us today. Dave Blair, I appreciate your time and your expertise. So thank you. And thank you all for listening today. This has been Paranormal Family Therapy, and I'm your host, Dr. Darren Wallace. So thank you, and we will see you next time.